Hi, I'm Dr. Ibrahim Aldoss from the Division of Leukemia, Department of Hematology and Stem Cell Transplant at City of Hope in Duarte, California. There are several challenges to implement asparaginase-based regimens in AYA patients with ALL, including that asparaginase-based regimens are not being considered to use by treating practitioners due to their complexity. There are also concerns about toxicity monitoring and management, limited medical facilities and experienced staffing, as well as lifestyle and psychosocial aspects of the typical AYA patient that impede accessing, adhering, and completing these regimens. The recommendations to overcome these barriers, including developing guidance for identifying appropriate AYA patients for asparaginase-based regimens, referring AYA ALL patients to specialized centers with availability of clinical trials and/or experience with the administration of pediatric-inspired regimens, developing strategies to increase AYA patients' enrollment in clinical trials, identifying patients with risk factor for toxicities to asparaginase-based regimens, such as older age, obesity, underlying liver disease, and to optimize asparaginase dosing and preventive strategies for high-risk patients. Also include recommendations to pursue individualized strategies to address barriers to care, such as availability of experienced nurses and staff, providing travel support for patients live far away from treating centers, facilitate collaboration between the treating centers and the community practices closer to patients' residence, and to collaborate between pediatric and adult teams, considering that pediatric practitioners in general have more experience with pediatric-inspired regimens compared to adult practitioners, and to build multidisciplinary teams to address the whole patient. Also, recommendations include to facilitate access and adherence of asparaginase continuation and completion in the absence of unacceptable toxicity to optimize outcomes, and to clearly communicate with the patient expectations of possible side effects, potential for experience multiple toxicities concurrently, and long-term risks when treating with a pediatric-inspired regimens. Together, these efforts can improve feasibility, safety, and completion of asparaginase-based therapy in AYA ALL patients, and ultimately could enhance clinical outcomes.